Hi, my name is Judith Hersh. I'm a OBGYN practicing in New Jersey. I have a specialty in pediatric gynecology and female sexual dysfunction. I've been working with Susan Markowitz as my primary nutritionist for at least 18 years now. She has been helping me both with my menopausal patients, dealing with bone loss, heart disease, and the need to lose weight, as well as my pediatric clients who I'm often seeing for menstrual irregularities and polycystic ovarian syndrome. I have greatly valued her recommendations when it comes to nutrition, but was most impressed 6 years ago when she came to me with the line of vitamins made by nutraMetrix. She showed me an x-ray of your typical vitamin that my patients might be taking, where you could actually see the vitamin pass from the ascending colon to the transverse colon, and it was even still visible in the rectum from 3 days prior. And this really brought home something that I intuitively already knew, is that it's very difficult for the body to break down these vitamins that my patients have been taking that are in a compressed pill form. Especially true with their calcium. Hard to absorb the calcium. I mean, basically what my patients were swallowing were pieces of chalk. And not only were they swallowing pieces of chalk, they often didn't have the appropriate amounts of vitamin D and magnesium mixed with that for them to best use their calcium. In my patients dealing with PMS, my patients on birth control pills, these particular patients were in great need of vitamin B, both because we know vitamin B in general is low in our teenage population because of their diets, but especially if they were using combined hormonal contraceptives. But again, getting those patients to take vitamin D in a way that was readily accessible was very difficult. Then she introduced me to nutraMetrix, and my world changed. I finally felt like I had a vitamin that I could recommend to my patients, and a vitamin I knew that was going to be helping them. I started taking the daily nutraMetrix packets that have both the daily vitamins, OPC3, and calcium in them, and have been happy to recommend those to my patients who went from taking 10 different pills to 1 packet a day, getting all of their essential vitamins, and the only thing they needed to add to that was their omega-3 fatty acids. My patients who weren't tolerating their calcium, I was able to offer them a calcium supplement that I knew had all of the valuable components that they needed to absorb their calcium. And not only that, with the newer research recommending that we offer lower doses of calcium, not the 1,500 milligrams to 2,000 milligrams that we've been recommending, being able to recommend a supplement with only 750 milligrams of calcium was very appealing. I feel that working with the nutraMetrix system has really helped me to help my patients. Patients who present to me with early menopausal symptoms often aren't ready or needing to go on medical management for their symptoms. And these patients have been greatly helped by the female support vitamins, or feminine. They've recently reformulated that product, and I'm so pleased that they did. They've added back some of the components which had been removed a few years ago, and now that they're back in the formulation, my patients, I would say 50% of them feel relief of their anxiety, night sweats, some hot flashes, just from taking that supplement alone. If they need hormone replacement therapy, that's fine, but it's even better if I can help them without a medication. So thank you to the nutraMetrix team for helping to provide me with a product that I know I can recommend with confidence to my patients.